Hi, this is Jen, your Medicare and retirement guide. Welcome back to the channel. Today we're gonna go over what happens when Medicare doesn't cover your hospital bill, which is a very persistent problem that I get asked on a regular basis from all of my clients. And if you find this video to be really helpful, please consider sharing this, like and subscribe, and then comment below on what other topics you would like me to cover in the future. All right, other than that, let's get started. So one of the biggest mistakes that I see some of my clients ask or miss when they're looking at their evidence of coverage is the difference between inpatient and outpatient status. Inpatient is when you actually stay in the hospital overnight. They admit you, you go to the emergency department, they see something that is wrong, and they would like to keep you there for a couple of days. That is inpatient. So that is one cost versus when something is considered outpatient. So outpatient means that you go to the hospital, you do whatever it is that you need to do to get well, and then you get let go the same day going back home. Those are two completely different designations, and knowing the difference is going to be the main issue between you getting a bill or you getting a copayment. That's it. Those two designations should be covered when you go and sign up for a plan for yourself. So there is a designation saying acute inpatient care. That's you getting admitted into the hospital. And there's the other designation, outpatient care. That is a completely separate thing on the evidence of coverage. Each one of them should tell you how much they are going to charge you depending on what designation the hospital tells you, and they should tell you prior if you're going to be outpatient versus inpatient. So certain things to think about when you're selecting a plan, for the following year. So one of the things that I want to go over is the observation status trap. So I have 2 decades of experience working in healthcare. I worked in multiple hospitals, and this is one of those moments where I had to really step back and understand these certain designations into certain patients. And one of them was the observation status. So what is observation status? Observation status is when you go into the emergency department and you're feeling a certain kind of way, you haven't been able to see your primary care physician, urgent care told you, no, you need to go to emergency department because this is beyond urgent care needs. You're kind of in the emergency department and they're not really saying anything to you, and they're not really letting you know if you're going to be admitted or not. So you are considered observation. They're just trying to keep you there. They're trying to see if you're going to have an episode of whatever it is that's happening to you happen within the emergency department to make you a legit admit into the hospital, versus you're there with a boo-boo, you just wanted to have someone pay attention to you. And this is where the future is going to be a little bit shaky. I'm not going to sugarcoat this. Our emergency departments here in the US are flooded with a ton of people, and doctors in the emergency department have to make a split decision on whether or not you are just going to be in observation versus being admitted into the hospital according to how many beds are available within the hospital. That is the other thing you have to keep in mind when these decisions are being made, whether or not to admit a person into the hospital. Is there bed availability? Is this person really experiencing an acute condition? And then depending on that decision, your insurance is going to charge you whatever the documentation is said by the hospital, by the attending emergency doctor. And though that may be a little insane, how is that legal? How is that possible? Well, the thing is, the hospital does have to follow a set of rules, right? Like they have to go ahead and see hour 1, hour 2, hour 3. They have to document every single hour that you are there in the hospital to see if this is someone that needs an additional care, or, what are we going to do? Are we going to transfer you to a different hospital? Are we going to have you admitted somewhere else? Is it mainly because we do not have beds and therefore we have to keep you in emergency department for hours? There are so many different reasons that go into why you will be placed in observation only versus admitted as an inpatient. And again, Medicare covers less and you will pay more depending on what the situation occurred within you going to the hospital or getting admitted or not admitted to said facility. Now, I don't want you to panic. I don't want you to panic when this starts occurring to you, mainly because you should know and you should have instruction by the attending physician and nurses while you're there as to why you are not being admitted. And this is really the responsibility of the beneficiary. You have to be very proactive while you're there in the hospital, which is probably like the worst possible scenario. You don't want to talk to anybody. You don't want to do anything with anybody. Like, you just want to be taken care of. But unfortunately, unless you have like an advocate there, and even the advocates have issues trying to figure out what is going on in such a robust environment. But it's important to stay calm and collected and ask, why is it that I'm still being observed? Is there space for me in the hospital? Am I gonna be charged for, just being here in the emergency department because you don't have beds available, but I need a bed available to me? What are my options? It's important to ask these questions because depending on the outcome, that's going to determine whether or not you get a bill in the mail or not. Now let's talk the scenario of you actually being admitted into the hospital. You went to the emergency department, they saw that your condition needed a little more attention, and there's bed availability. All the planets aligned and you end up being admitted into the hospital. Now, one of the things that I had to deal with a lot when working within the hospital and administration, billing and all of that was the 2 midnight rule. So Medicare generally covers stays for at least 2 midnights. So if your stay is a little bit shorter, they could justify it saying that this was an outpatient situation. But it's important to get that documented. I can't stress enough to people that you need to get your medical records whenever you're leaving a hospital, and you need to see what was written and why certain things were justified in a certain way. Because in the event that Medicare or the insurance company is going to end up sending you a bill for whatever designation, the hospital gods declare for you, is going to determine how much you are going to pay out of pocket. So it's very, very important to stress to the doctors that, you are there to be seen for your acute condition. Even if it's just for a day, that should be considered an inpatient stay at a hospital because you were admitted, you were put in a bed within the hospital. That is inpatient. And if any of the documentation or the billing codes reflect any outpatient, and it could be just a mistake from a biller, that's also another issue that I deal with on a regular basis with my clients, is they get a bill and it's for some random $162.17, something extremely bizarre and weird that it's not a clear-cut number. So especially if you have Medicare Advantage, you will never receive a bill that is weird and strange like that it's a weird number on the bill for you. So never pay those. That usually means that there is a new person that they hired that didn't know the billing codes, they didn't know what to put in, and they threw out some random number and sent it to you in the mail. That should never happen, especially if you're on a Medicare Advantage plan. When you're on straight Medicare fee-for-service, that's a different beast entirely. But even still, pause and ask why you are receiving this bill, what was said in your documentation, what billing codes were sent to Medicare or to the insurance company, so that you can go ahead and see if this wasn't an error. And most often than not, like 90% of the time, it's a billing code error, and no one double checks their work and they just send it to you. So do not panic. Make sure you just grab all the documentation you need. It does take some work on your part to go ahead and reach out to the hospital, to reach out to the insurance company, to put in a billing claim, getting an appeal. And there's ways to do that as well. You can always put in an appeal and ask your insurance company to go ahead and double check somebody else's work. It takes some time, but at least the process has begun. If you are on straight Medicare Medicare fee-for-service, there is always the state health insurance program. They offer free services to go ahead and help you, walk you through these different processes. There's also lawyers that specialize in appeals if it becomes a little bit more complicated or the bill is not $167.17, but hundreds and thousands of dollars. So make sure you reach out and see, if there's different advocate groups within your area that can help you, walk you through your process of getting the bills appealed. But keep in mind, within your evidence of coverage, if you get a bill and it's a copayment and it's stated in there that you are responsible for paying set pricing, then that is something that you agree to. So make sure you always look over your benefits every single year. If you know that you have to go to the hospital, if you know you're going to get a surgery done, always double check to make sure what your copayments are going to be for those designated procedures. So that's it for the video. That's how Medicare and hospitals work together. I hope I answered a lot of your questions and concerns. Remember, if you found this information useful to you, consider sharing it with other folks in the community so they have access to this important information. Like and subscribe, and then comment down below to ask any additional questions that you would like to learn about our healthcare industry here in the US. Other than that, I'm Jen, your Medicare and retirement guide, and I'm wishing you all good health, and I'll see you in the next video. Bye-bye.